to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein. And today we're going to talk about breast cancer. I've invited Dr.CarolLourie, who is a dedicated practitioner with over 3 decades of clinical experience as a naturopath, acupuncturist, and homeopath. She's helped thousands of women recover their health and restore their life through her integrative and complementary protocols involving focused nutrition, targeted supplementation, lifestyle changes, and an empowered mindset. She specializes in complex and chronic disease management, specifically focused on the emotional aspect and metabolic factors of breast cancer. In addition to her clinical practice in San Francisco, she developed an online program where she's able to bring her knowledge and caring to women throughout the world. Welcome, Dr. Lourie.
Oh, thank you so much. And just please call me Carol.
Oh, okay. Yeah, thank you for that. So I would love for you to start with, how did you even get into this? I'm so excited to learn more about what you do. And, breast cancer, cancer is a very specialized area, but breast cancer is even more specialized. And I'm just so excited to learn more about what you do, because there's so many people that need this kind of care, especially in an integrative fashion. We don't have many people like you out there.
No, and we need more.
Yes, we do.
So let me just begin with saying that one morning I picked up the phone and I thought it was a crank call. I couldn't understand who was on the other line. And finally, I realized it was my dear friend who was hysterically crying, saying they found a lump. And this is the experience of many women when they're initially diagnosed. They go for a routine mammogram, or they do a self-breast exam, or their doctor feels it and they go for a mammogram, and then they get that phone call. And I, in that moment with my friend, committed to going through every single aspect of treatment with her, which was 18 months of chemotherapy, radiation, and then she had to have her uterus removed a few years later due to the side effects of tamoxifen. And not only was I in the treatment with her, but I also took care of her using my skills as a naturopath, acupuncturist, and homeopath. And one day we're at UCSF where she's being treated, and the doctor looked up at her blood work and to us and said, "I don't know what you're doing, but I want all of my patients to be doing that too."
Wow.
Because she was in the middle of chemo, she didn't have anemia, her white cell count was really good, she wasn't depressed, she had vital force, she looked great, and she had kept a lot of her hair. And it was not the typical experience of what a woman has happened to her in chemo. So this was really the beginning of my taking my studies in a very specific direction. And I attended the Advanced Oncology Roundtable with Donnie Yance of the Mederi Foundation in Ashland, Oregon. And I've gone to other integrative cancer conferences over the last several years, and I've really up-leveled my skill set, because as you said, breast cancer and cancer in general is very specific.
It really, really is. Yeah, it really requires a specialized approach. And exactly what you're doing is going to specific conferences. We talked a little bit about Lyme's disease, and it's something that I diagnosed, but I don't treat it because it really changes. Over time, really changes year after year, and or even months after months, right? And you have to stay on top of it. It's really important to go to those kinds of conferences. That's great. So thank God she had a friend like you. Thank God. I mean, really, she's so lucky to have had you there. And how is she doing now?
Well, it's 16 years and she's cancer-free minus her uterus, and she's doing really well. And she's on a whole protocol of supplements, and she juices, and she lives a very healthy lifestyle. And when she was initially diagnosed, one of the things she said to me, and I hear this often, is, "How could this happen to me? I thought I was healthy." So breast cancer can happen to anyone. We all know someone who's been diagnosed with breast cancer. A woman has 1 in 8 or 1 in 13% of being diagnosed with breast cancer. If there's a genetic SNP in your family and you have colon cancer, there is an increased risk of that. It goes up to between 13 to 15% risk. And thank goodness we have medical diagnostics, because we need the best of both worlds. Many women come in having been already tested for the what is known as the BRCA1 and 2 gene because their mother had cancer, breast cancer, and they want to know. And that is a really wonderful thing to do because I can then help them diagnose how is their estrogen and hormones being metabolized.
Mhm.
And if there's a problem in that metabolic pathway, we can then address it with functional medicine, really dial in their nutrition so they're eating a very healthy diet and put them on a standard protocol of antioxidants and a healing smoothie, make sure they've removed all toxic chemicals from their home and are getting positive movement. And then they go for more advanced diagnostic monitoring through their OBGYN doctor usually, or their oncologist. So that's an empowered approach to life. It's being informed, deciding that, okay, I have this SNP or this gene, but just because you have it doesn't mean it needs to get turned on. So that's the difference between nutrigenetics and nutrigenomics. You can, if you know you have a certain SNP, you can say, nope, I don't want that one turned on. I'm going to do the best I can to keep it the off switch down. So
That's right. People don't realize that they have the power to do that with lifestyle and dietary changes. And that's really a key thing. And I love the fact that you say that you really need to have a foot in both worlds, the conventional world and the integrative world. And it's the best of both worlds that you're working from. And that's so important because one doesn't have to negate the other,
no,
at
we
all.
complement each other. And there used to be this phrase many years ago, it's the war on cancer.
Mhm.
And in the olden days, like in the 60s, having breast cancer was a shameful disease, and it was you needed to keep it in secret and be in the closet. And when Gerald Ford was president, his wife, Betty Ford, came out with her breast cancer.
Mhm.
And that changed the attitude in America towards breast cancer. She did a wonderful thing by letting people know that she'd had it and she has it and what is she doing for treatment. And it removed a lot of the shame that women felt about it.
Yes,
And
I remember
remember
that.
that?
Yes,
Right.
I
So,
totally remember that. Yeah.
right.
Yeah, and it's interesting how there's certain areas in the conventional world that embraces the integrative approach, like cancer, oncology. There's also nephrology and geriatrics, but they're focused in very specific centers because it is a multidisciplinary approach. And I can't wait because I know it's going to happen. I can't say it's going to happen. I just can't wait for it to be across all specialties, all areas of medicine. And my hope is to have it. There is a multidisciplinary approach in the psychiatry world, but it doesn't include dietary and lifestyle changes in the way that it can be, and using the integrative approach in the way that it really can be. So my hope is, I'm praying for that and hoping to, at least that's been my mission, to make that happen at some point. Yeah. So
Well, it makes sense, doesn't it? How
it
can you feel
does.
well if you're eating, processed food and sugar? I
Right.
mean, right?
Right. I know one thing that really absolutely needs to change, and I'm sure I know you must believe this too, is that the hospital food,
Oh
the
my
food
goodness.
in the hospital is so inflammatory and toxic as far as I'm concerned. You have surgery and then they're giving you a burger and
Yeah,
fries.
literally.
You
The next
literally.
that evening. And really, when you go in for surgery, you need to have cleaned out your intestines as if you're going for a colonoscopy because your intestines shut down for surgery. And then they should be on a juice fast and healing smoothies for a couple of days, getting lots of antioxidants and homeopathic arnica. And that is not what happens.
Right, exactly. And I think the worst thing is Ensure. I mean, I think
Yes.
Ensure has its place, but there's so many
No.
better things out there. So Ensure to me is complete garbage. Hopefully, and I know that there are some companies out there that make a better type of
Mhm.
food, enhancement, replacement, whatever you want to call Ensure, because there are certain people who just can't eat, and they need something like Ensure. So it has, but so we're getting off topic. We're
Okay,
going down a road where
that's
I want to
fine.
come back to some things that I really want to talk about. One of the things that you mentioned is that there's, when someone is diagnosed with breast cancer, and like you said, shockingly, like, oh my gosh, I have a really healthy diet and lifestyle. Why me? So, with that shock in mind, I'm sure there's some things that some people overlook. And I would love for you to talk about what people should do right at the get-go when they get that diagnosis.
It's a great question. I love talking about that. The first thing to understand is that it's not a surgical emergency where you have to go the next day or that minute for a biopsy. I mean, rarely, unless you had a huge tumor and it was pressing on something, which I can't imagine that ever happening, but you have time to gather yourself and to understand that this is going to be very disruptive to your life. And how are you going to compensate for the fact that you're not going to feel well and you're not going to be able to do all the millions of things that we do as women every day for yourself and your family and if you work outside of the home. And then you want to gather your healing team. First, you need to make sure who is going to make a Google sheet and put every single thing that you do on it. So your friends and relatives can step up to the plate. They can sign up to do some of the things that you do: food shopping, delivering meals, taking care of your kids back and forth from activities, whatever, cleaning your house, arrange to have some time off from work around your chemo cycle, and maybe you need a second opinion.
Mhm.
So that can take a couple of weeks. And then you also want to find someone such as myself who's going to help you reduce the side effects of chemotherapy. Because chemotherapy is like a marathon. You don't wake up one day having never worked out and go, I'm going to run 26 miles today. You need to be prepared. And there are specific ways that are science-backed to prepare for chemotherapy to reduce the side effects. And one of the first things is intermittent fasting. There's a lot of research in PubMed about the benefits of this. When you intermittent fast, the cancer cells go into starvation mode and they go, oh my goodness, I'm so hungry. And your healthy cells go into protection mode. So when that chemotherapy comes in, the cancer cells grab up the chemotherapy more than the healthy cells, and the healthy cells are protected. And you also want to empty your intestines. You don't want to go into chemotherapy all constipated. Most Americans are. And you want to bring some healing juices with you. You want to do the smoothie afterwards. If you're on a supplement regime, you want to stop your supplements 3 days before and 2 days after. So you're being respectful of the chemo and you're not interfering with the medicine from the chemo. And having a positive mindset that you are choosing to do chemo and then visualizing that it's going to find those cancer cells and eradicate them, as opposed to saying, I have to do chemo. I hate this. It's going to make me sick. I mean, that impacts your experience, right?
Absolutely. Absolutely. Yeah. Mindset is extremely important. I don't think people really realize that the research actually shows that mindset really helps you to have success in the long run of anything that you do, not just
Yes,
chemotherapy or beating breast cancer. Right. So
absolutely.
can you talk more in specifics about how to prepare your body? You mentioned a whole bunch of things, supplements and juices, and can you do a deeper dive in terms of some of the juicing or smoothies that you're talking about?
Sure. A good, first of all, your vegetables need to be organic, and you need to have a juicer, even a champion juicer, which is easily found on Amazon. Sometimes you can find used ones. You don't have to spend $1,000 on a juicer. I studied with a juicing expert in New York, so I have a lot of great juice formulas. Juicing, you don't want to put a whole bunch of carrots in there or beets because they're naturally sweet. So it needs to be a balanced juice. So 4 ounces of carrots to 4 ounces of celery. You want to always have equal amount of carrot and celery. You want to, when you juice parsley, you just want to use the tops of the parsley. So you could take a handful of course, organic, either curly or Italian parsley, and stick that in there with a whole cucumber.
Mm-hmm.
If it's organic, the skin can stay on, and then maybe like a half an apple. And that is a very soothing, healing juice. You could also put a knob of ginger in there with the skin removed. If you can find organic turmeric root, that's a great little thing to put in there. And you have this antioxidant, phytonutrient, delicious, rich juice. Now, When you have chemotherapy, I recommend that you bring what I call some basic healing teas with you. And as a Chinese medicine practitioner, ginger and mint have like thousands of years, hundreds of studies. They really they really show that ginger is one of the best stomachic, which is a supportive herb for your stomach on the planet. So you take some ginger, you take the skin off, you slice it up, you simmer it on top of the stove for about 10 or 15 minutes. And then if you have fresh mint in your garden or tea bags, you take about 2 or 3 tea bags or a big handful of fresh mint in an 8-cup Pyrex glass measuring cup, put everything in with boiling water and let it steep for 20 minutes, make about 4 cups of that. Bring it to your chemotherapy in either an igloo or a glass jar and drink it as you're getting your infusion.
Wow.
Those are really 2 ways of keeping your body hydrated and giving yourself nourishment and working against the nausea that is sometimes a side effect of chemo.
Right, right. Yes. And does it also help with fatigue? Because that is a side effect as well,
Well,
generally.
fatigue's a little bit different. There's some supplements that I would use for fatigue. The juice, if you keep your nutrient level up, it will definitely impact the fatigue. But for fatigue, that usually comes from more bone marrow suppression. And so drinking organic bone broth, if you eat meat, making a smoothie that has certain herbs like coleus, forskolin in there, using a supplement made by Natura Formulations called Botaniball and Botanical Treasures. They really nourish your bone marrow. That's what you want to do for the fatigue.
Great, great. Oh, that's great advice. Yeah. So when it comes to juicing, sometimes people, are concerned about losing the fiber that comes with these vegetables. What is it about juicing and removing that fiber that is different than just having, let's say, a smoothie of pureed, like putting all those vegetables in and just having a smoothie with the fiber?
Well, when I juice with the Champion or with the Hurum, you're still getting an enormous amount of fiber that comes through in the extraction. You can do that. I don't think it's necessary. People, I mean, if you're on a healthy way of eating, you get an enormous amount of fiber. But if you want more fiber, absolutely stick it in a big juicer and juice it all up and drink it all down. It's fine. I prefer to extract and get a concentrated juice then, and there is still quite a bit of fiber in it, because there are times when I would strain it and I would see quite a bit of fiber in the strainer remaining.
Yeah. So I guess you would have to have you would have to intake a lot of that if you were to keep the fiber, all the fiber. It'd probably be too much to eat or to swallow if you wanted all those nutrients. So it's really, the goal is to concentrate those nutrients, and that's why you do the juicing.
Exactly.
Yeah, I think it's
Exactly.
important to explain that to people. So why juicing? Why can't I just eat carrots and
Oh, you can't eat
celery?
enough. You
I
can't
know
eat
you
enough
can't
of
eat
that.
enough.
Yeah, that's the
Exactly.
answer. You can't eat it. I mean, there's just no way.
Right, right. So you're really extracting real nutrients in a concentrated form by doing that. Yes.
Yes. Yeah.
Great explanation. Yeah. So anything else that you recommend to prepare your body and your mind for chemotherapy, radiation, or even surgery?
Okay, radiation is a different topic. You need to really understand the benefits of radiation, because there are a lot of side effects of radiation that either you're not talked to about by the radiation oncologist, or they sort of gloss over it. And if you have a certain type of breast cancer called DCIS, the next test should be something called an oncotype breast cancer recurrence index, and that will give you the benefit. It'll give you a score, and then it will give you the benefit of, if you do radiation, it will reduce your risk for a number of years by XYZ%. So if your score, ideally you want your DCIS, your oncotype score, to be less than 23 is sort of the cutoff. But if it's 23 or over, then the doctor might recommend chemo and or radiation, depending on many other factors. If the radiation score risk reduction, if you do radiation, it's 5%, and you're willing to do really clear protocol and integrative medicine and lifestyle, you can decide, well, maybe I don't want to do that, but you need to really step up to the plate and be willing to long-term take your supplements, do the smoothie, do the juicing, do the lifestyle changes, maybe learn how to do mistletoe injections on yourself, because cancer is a metabolic disease. And when you have your initial treatment, it addresses the tumor. And then it's our job, the integrative practitioner and the woman who has breast cancer, had breast cancer, to really address the inner or tumor microenvironment inside her body to make it inhospitable to regrowth.
Right.
And one of the side effects of radiation is that it can cause more aggressive cancer in the opposite breast. And that can happen many years post facto, after the fact. So you need to really take the whole picture and sit down with your oncologist and someone such as myself and listen to your intuition about what it decides for you, and be willing to go off the path of regular standard care if you're also on the other side feeling very confident that you're going to be able to stay on the path of the entire protocol which you need as doing integrative care.
Right, right. So the oncotype score, we'll have to put that in the show notes for people to do more research on if they're interested in learning more about that. So one of the things that we talked about was mindset. And so what would you say is the top thing, or how would you use mindset to ensure the success of treatment? What are the specific variables that are necessary when it comes to mindset?
Well, I think number one, help the woman get over the shock of the diagnosis.
Right.
And until we do that, we're sort of stuck.
Right.
And I use homeopathic remedies for that, and maybe acupuncture if the person is local.
So
Tai
some of that,
Chi,
go
pardon me?
ahead. Go ahead.
Tai Chi, Qigong, and yoga are activities that have been around for thousands of years. And I have this attitude: if something's been around for thousands of years, there's validity to it. So I think getting a woman involved in that from the very beginning is very helpful. And I, as an acupuncturist, I like to say that your energy is like a free flowing river, and you want to keep it like a babbling brook. But if you have trauma and stagnation and you're stuck in emotions or depression or anxiety, the water gets to dry up and mud forms, and that in Chinese medicine is blood stagnation, and that creates a tumor. So it's our job to keep this river, your little babbling brook, flowing smoothly with lots of nourishment and lots of self-care. YouTube has thousands of people on it that you can find somebody that you like to teach you how to do yoga, Tai Chi, or Qigong. And when you start, you're not going to be good, but who cares? You just keep at it. And after a month, you're going to know the rhythm of the movements. And then after 2 months, they're going to start coming naturally, and you're keeping and you do that every day.
Right.
So we have to develop new rituals of healing and self-care, not just jumping out of bed, going to the bathroom, and then having a cup of coffee. We need to change the ritual in the morning of how we're going to empower ourselves to have a positive day.
I love that. I love the way that you talk about mindset in a very physical way. It's not just your thoughts. It's not just meditating, because yoga actually is a form of meditation. Qigong and Tai Chi are forms of meditation. So it's looking at the whole person, and it's a spiritual connection as well. So mindset means many things, but you're absolutely right that you have to start somewhere and build on top of that, and get that in place and build on top of that, and creating these rituals. I totally agree. I love everything that you're saying about this. But one of the things that you mentioned is depression, and I'm sure part of the shock does go to have people go to this place of depression and anxiety. And so some of this depression may have been there prior to their
Yes.
diagnosis of cancer, and then it gets worse. But some people get depressed, and there's, depression's multi-layered. There's so many things that happen in people's lives that can then come together as depression. And we don't know a whole lot about, how much depression is part and parcel of cancer, of cancer causing the depression. I don't think, but it certainly is a piece that needs to be addressed. Can you talk more about that in your experience with people with
Absolutely.
breast cancer and depression?
I think it's hard in our society not to have somewhat of some aspect of depression. And the term depression for me is chapter heading, because as a homeopath, when I start to investigate, well, you're having depression, what's the sensation? What's the feelings connected to it? Everybody's experience is very different, and nobody has the same exact experience as the next person. So we tend to put sadness and maybe even anger and trauma in this umbrella of depression. And I think that part of the work we need to do to heal is to look back and think about, well, when did this feeling, whatever it is it sadness? Is it feeling stuck? Is it as heaviness in my chest? Is it I'm in a relationship that I'm not being nurtured and I don't like my spouse anymore and my mother's been abusive to me? I mean, people have a lot of stuff in their lives that they keep quiet about, especially women. We
Mm.
don't speak up. Um, and I just want to reference the messaging we get in society around depression as women. There's an advertisement on TV, which is running right now, where it's a sort of like a cartoon, but the house is a mess. And the woman is sitting there in the middle of this pile of laundry. And the ad is for depression. And the first time I saw this on TV, I got so upset. I'm like yelling at the TV, why is this the woman's job that the house is a mess? Why
Mm.
is it her fault, quote unquote? What happened to her that she's feeling sad? And then
Right.
she takes a pill and the house is fine. Beds are made, dishes, laundry, the whole thing. And it's like women need help. Why? It's not only our job to keep the household together. If you're in partnership, everybody needs to contribute.
Right.
We're
Right.
all busy. Everybody needs to contribute, and we don't speak up. So we get overburdened in our psyche, and then we feel like we're being smothered, and then we have depression. And cancer is an arduous journey, no matter what type of treatment it is. It disrupts your life. So you have this diagnosis, and you already have unresolved issues in your life, and you're putting chemicals in your body that are making you feel physically unwell. So I think it's extremely normal to be depressed,
Mm.
to be sad, to feel disrupted, to feel like you're a victim of this treatment and this disease. And part of turning it around is there's a lot of unpacking to do. It takes a while. But the first thing is we have to stop feeling like a victim and learning how to stick up for yourself. And breast cancer, as a homeopath, has this certain energy to it. And that is in homeopathic philosophy known as the breast cancer miasm.
Mhm.
And part of that is a woman is always taking care of others at the expense of herself. And she's saying, yes, yes, yes. And she's rushing to do this and rushing to do that. And then she has blurry boundaries.
Mm.
So that goes with people ask her to do things. And even though she really doesn't want to, she says, oh, okay. And then she's not taking care of herself. So we need to really get those boundaries very clear.
Right.
So it's a
Absolutely.
whole lifestyle component. And I'm a naturopath, so I always want to do things naturally. And there are natural herbs like St. John's wort is very high on the antidepressant spectrum, but physiologically, it also works as an anti-cancer agent.
Mm.
So herbs are pleomorphic. They don't just do one thing. You can bring them in to do many things. You can have herbs to help your mindset and also support an antioxidant component in your body.
Right, right. Yeah, absolutely. Yeah, I mean, St. John's wort is a great antidepressant, and is equally effective as some of the SSRIs.
Yes.
The thing I want the audience to know, because I don't want everyone to run out and put themselves on St. John's wort.
No, don't do that.
Yeah, it does interact with other SSRIs, and it can interact with lots of medications. So it's really
Yes.
important to discuss that with your provider if you are in treatment or on other supplements or medications. But
Right.
it is a great supplement, like you said.
Don't
Absolutely.
stop taking your SSRI and then switch over to St. John's wort. You never want to do that.
Right. Yeah. So fantastic information, and I think there is something about taking control of your life. It's an opportunity, not just with breast cancer. Sometimes I see chronic disease as an opportunity, or when you're faced with a sudden diagnosis, it's an opportunity to stop and really review your whole life. Like, why did this happen to me? Well, maybe the universe is telling you to, we really need to do a whole review of how you're conducting your life. And it's an opportunity to try to straighten that out as well.
100%. Absolutely. I think a chronic disease is a message that what's been happening for the last 5, 10, 15 years isn't working for your soul. Even though your mind may think this is what you wanted, I wanted this job, I wanted this big house, whatever, something is off. And it's really easy to not pay attention to the clues. But when you become sick, whatever the disease is, it's a wake-up call, like, hello, here I am. I'm disrupting your life. You got to start. We need a little rewrite here. And what has to happen? What needs to be thrown out? What needs to be kept? How do you need to change?
Yeah, I agree. Yeah, one of my favorite quotes, I said quotes, is every crisis is an opportunity.
Yeah.
I really love that. It's been my favorite and still is, since for the last 3 decades, I have to say. So
That's beautiful. Yeah, it is an opportunity. You can't, breast cancer plops down on your path of life and you go, what the heck is this doing here? I don't want you here.
Right.
But you can't walk around it. You got to go through it.
Right.
So how can we make this the most positive experience for you? And I said that to a woman and she started yelling at me. She said, it's not positive. It's horrible. I go, well, let's see what we can do to make it positive.
Right.
You have support. You're going to get rid of some things in your life that don't work. You're going to add some things that nurture you. Let's see how we can make it positive for you.
Absolutely.
Because I think it is possible to be healthier at the end of breast cancer treatment than you were when you were starting. And that's a win as far as I'm concerned.
Absolutely. And, people come out of the woodwork to help you, and, you realize, and, who really cares about you, but also you can have gratitude for those things too. So there are opportunities to strengthen relationships and meet new people, have new experiences despite having breast cancer or other diagnoses. So I know it's probably hard for some people to hear that, but once they're on the other side of that, then they could look back and it's like, yeah, now I know what you mean. But it does take work to change your mindset. It definitely takes work. It's almost like a grief process on some level.
You have to become aware of those negative verbalizations you're always giving yourself. And we always do. And I'll give you an example. A woman just started walking for her positive movement. And she went where she lives. It's very hilly. So she walked out and she walked up this hill right away for 5 minutes and she was tired and she turned around and walked down. And then she emailed me and she said, I only walked 5 minutes. And I emailed her back, 5 minutes up and 5 minutes back for the first time. And you've been on the sofa for the last several years. That's fantastic. But then I had a phone conversation with her and she said, her negative mind was going, well, it's only 5 minutes. You're in such bad shape. How are you ever going to go from here to there? And I said, let's change the narrative. You've been feeling really horrible. It took 2 months of you juicing and changing what you eat and doing the healing smoothie and taking your supplements. And now you finally have energy to begin moving. And I think that's a huge success, 5 minutes.
It is.
And your negative mindset is going, didn't do a good job. It's never going to get any better. You're just going to be this blob on the sofa all the time. And she went, oh yeah, look at that.
Yeah.
or forget that, just forget that. So once you become aware of that negative mindset, turn the switch off.
Right, right,
And you
right.
can't say, goodbye. You just have to say, nope, I'm not going to listen to you. And then I said, you should be really proud of yourself. And she goes, yeah, I am. Pat yourself on the back. Tomorrow, let's do 6 minutes up and 6 minute back. And so, now it's 18 months later, it's between 2 and 2.25, 3 miles, 4 or 5 times a week, up the hills, down, back, and she started lifting weights, a few pounds, and her basic metabolic index has decreased. She's much healthier. Her blood sugar is better. And she had to throw out all of her old clothes because they didn't fit her anymore because they were too big.
Wow.
I mean, it's a whole
That's
moment.
awesome.
Yeah.
That's so awesome. It's exactly. I had the same experiences with my patients as well.
Yeah. It's
Mindset
really
is huge.
wonderful.
It could really make or break you. Changing your mindset is so, so important, which is why I have my patients work with health coaches.
Yeah.
Health coaches are really, really great.
I agree.
To even notice that and have you notice awareness is really important, and changing that mindset is so important. So I do want to go back to something that you said I think is so important to just really emphasize, is that in order to prevent a recurrence, you have to make sure that you look at the environment. And that's true for every illness, not just breast cancer,
Of course.
to make the environment inhospitable so that the breast cancer doesn't return. And that's also true for pathogens. So when you have gut dysbiosis or infections or chronic infections, wherever you have some kind of dysbiosis, you want to make the environment inhospitable so that it doesn't come back. And, can you talk more about that? What else you can do besides what you can do actually, to make it inhospitable besides the, changes in diet and lifestyle? There are specific interventions that you recommend?
Well, I think nutrition is a very important part of it. And the foundation of cancer is that sugar drives cancer. Sugar feeds cancer. 1918, Otto Warburg, a little German scientist, discovered that cancer, given a choice between oxygen and sugar for its what I call cancer gas tank, will choose sugar, even though it has to work much harder for it and it gets much less energy or ATP. That's now known as the Warburg effect, and he won the Nobel Medical Prize for that. We forgot about that for many years, but it's had a resurrection. And now there are my colleagues, Dr. Nasha Winter wrote, Cancer is a Metabolic Disease is a wonderful book. And it's the beginning of understanding that you have impact over, you want to feed your cancer or you want to not starve it. So how you eat is a very critical component of that, but also supplements and herbs are a very also important component of it. And unfortunately, this is not an aspect that regular medical oncology incorporates into their treatment. When I was at UCSF with my friend going through her chemo infusions, 5 times in a 4-hour experience, she was offered Ensure, orange juice, not a healthy Gatorade, and a popsicle and a cupcake or a cookie when we were done. So it was like, they don't understand that. The more you remove, it was very alarming. The more you remove sugar from your body in the form of not just white sugar, but also simple carbs, right? And even if you're gluten-free, a lot of those gluten-free products have very high glycemic indexes because made with brown rice flour, rice is a very high glycemic food. So let's talk. That's one of the reasons I love the healing smoothie. It's because it has a protein, P-isolate protein, or a whey powder, or a ketogenic style powder. And then it has antioxidants. Quercetin this one company makes quercetin powder, and you can put it in your smoothie. It's, quercetin is a very powerful antioxidant for cancer, specifically for breast cancer. We can put in more antioxidants in the form of D-ribose, and then we can put some herbs in it. And if you have a problem with losing too much weight which is not uncommon with cancer. Then you
Mhm.
can make the smoothie have more calories by putting in some organic nut butter like almond butter, cashew, or macadamia nut butter. You
Mhm.
can put in an egg yolk for lecithin. You can put in a little tablespoon of molasses for iron, and you put in some fruits such as blueberries or blackberries, which have phytonutrients.
Wow.
So
That sounds
that
delicious.
it is. I wouldn't ask people to drink something that didn't taste good that I wouldn't want to drink it myself.
Right, right. Great. Yeah.
So, and everything I suggest, I have checked out myself, eaten it, done it. I've been there. So I think that's a very important part of working with people. It's like, I wouldn't say drink this and having
Right.
not drunk it myself. And I add some chia and flax seeds to it also. So that also helps alter the inside environment inside your body. And also how you think, how you talk to yourself can either create
Mhm.
inflammation inside or health. And there is an attitude of, it's a war on breast cancer. We're going to attack, we're going to conquer. And those words are very inflammatory and they create, in my opinion, they contribute towards illness or disease.
Right.
I think we need a more feminine approach, which
Mhm.
is we need to start engaging with this diagnosis and start having a conversation with the tumor, even if it's been removed.
Right.
We need a more feminine approach because what are we attacking ourselves?
Right. Right. Yeah.
So
I mean,
what
you have to
happened,
think about it. Yeah, you have to think about it as there was something within you that invited it to come in. So you can get to know it and invite it to leave.
well, I don't know if that's a conscious invitation that a
No,
lot of women,
no,
yeah.
I don't mean
But
conscious. Yeah.
if you start having conversations with your breasts or the tumor or whatever it is, your arthritis, your gut, because you have Crohn's disease and you're having diarrhea 15 times a day, you're going to get a message. Your body will say, I really do not like where you're living, or you're being in an abusive relationship with your boss, or, you know, it's too much stress. You got to take this off your plate. I mean, you will get messages and some of them will shock you.
Mm. Hmm.
And
Absolutely.
it's a learning process. It's like peeling off layers of the onion. And we all need help. As you said, you have health coaches. We're living in insular society. In the olden days, we had community. And
Mm.
if you weren't feeling well, you went over to the hut where the wise woman or man was. And now we're stuck in our homes with television, which is not such a great asset as far as I'm concerned. We
Agreed.
all need support. And we're not super women. And there's this issue with women with breast cancer that they think they can do it themselves,
Hmm.
which I think is a misnomer. I mean, you don't do neurosurgery yourself. You don't fix your car yourself unless that's your expertise. Why do you think that you should or could or you're supposed to figure out your supplements and know how to do your diet and go do all this together? I
Right.
always go to people for help. We all need help.
Yes, we all do. And you can also let people know where your boundaries are too.
Yeah.
And it's okay to say, no, I'm sorry, I can't do that, but you
You
can
don't
go.
have to say I'm sorry. You can just
Yeah, you don't
say,
even have to say,
don't
you're right.
take out the I'm sorry.
Right. Exactly. Exactly. Yeah. Great. So yeah, I know we need to wind down because you have a time limit and I really appreciate your time. You've given us so much information and I know that I want to let people know that they can find you at www.CarolLourie.com. And you're also on Instagram at CarolLourie Health.
Mhm.
And you're going to provide something for our listeners to look at that I will attach to the show notes if they want to know more. Great. Thank you so
My
much,
pleasure.
Carol,
I'll send
for
over my ebook for healthy nutrition and how to eat in a really healthy way that works not just for you, but your entire family.
awesome. That's fantastic. Thank you so much for sharing that. And I'm looking forward to finding out more about your smoothies and juicings.
Okay.
Great. Yeah. Great. Thank you so much. Appreciate it again. And God bless you. Take care.
Honor to be here.